Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community.
Thank you for joining us today. You are listening to Mahaska Health Medical Minute. My name is Renee Edgar, registered nurse here at Mahaska Health, and I'll be your host for this episode. Today, we are speaking with board-certified, fellowship-trained orthopedic surgeon Dr. Gehrke and registered nurse Sarah Hougland. They both serve in our orthopedics and sports medicine department. Welcome to the podcast, you guys.
Thank you.
Thank you.
So I always like to begin with just talking about a little bit about you, who you are, what you enjoy outside of work, and just get to know you a little bit. Sarah, tell us a little bit more about you and what brought you into being a nurse here at Mahaska Health.
I am married, have 2 young boys, so I spend a lot of my time with my children. I enjoy working out and just trying to enjoy the time relaxing.
Try to enjoy work,
Yeah.
life outside of work.
Yes.
Any animals or dogs?
We have fish, and that's
Okay,
it.
that's fine. Dr. Gehrke, tell us a little bit about you.
Well, my wife and I moved here 2 years ago, roughly, to join the Mahaska Orthopedic Group and the Mahaska family. We've really enjoyed our time here. The opportunity to come down here occurred when Kevin came down, and the CEO. And after 22 years in the city, the big city of Des Moines, in a big group, it was time for a change. And at 63, we moved down and have enjoyed every minute of it ever since.
A change indeed, and what a blessing.
It's been a great change and a blessing for us.
And you love our little community.
Love it.
It's
Absolutely love
not
it.
really little, but it's
No, but there's everything you need. And it's a wonderful group of people here at the hospital and a wonderful city.
what a call to medicine for you both, and exciting to hear what brought you here. And Sarah, becoming a nurse, what led you there?
I had a great aunt who used to take care of me from the time I was born, and she had several health problems that as I got older I watched her battle, and she ended up passing away. And so I decided at that point, after watching her and everything, that was something I was really interested in and passionate about, was medicine. And so I decided to become a nurse so that I could help other people and take care of them and provide education to them as well.
Well, it's so often described as helping, but truly you have to have a heart of compassion. Board certified and completed 3 fellowships in general orthopedics, foot and ankle surgery, and sports medicine. That's a lot.
Well, it's I'm a slow learner.
Tell us a little bit about orthopedic. What cases what's your day? Tell us.
Well, the days are split between clinic, certainly, and surgery.
Sure.
We work pretty much 5 days a week, and oftentimes twice a week for surgery. And surgery days entail a whole variety of things, and that's the wonderful part about it.
Mm-hmm.
We take care of lots of issues, everything from hand injuries or abnormalities to knee problems, to hip problems, acute fractures, joint replacement. So we've got a whole variety of things we do in the operating room. The clinic is often busy, and it's fun. And working with Sarah, we really are able to get people through and I think provide the service they need.
You have a great team.
You know, a little anecdote about Sarah. About 3 weeks ago, we had a patient who was referred to us
Sure.
with a broken wrist and needed the wrist fixed.
Sure.
But couldn't get in, although she lived a few blocks away, couldn't get in that afternoon for surgery the next day. And we were time constrained, and we could do surgery the next day, but otherwise it would be a few days later. And so Sarah took it on herself to go leave the hospital, bring this patient to the clinic to allow us to see her and get her surgery done in a timely fashion. That's the kind of care these folks provide here.
You're not just in the orthopedics department. I've seen you in ER. I know that you work in different areas of the hospital. You work with our physical therapy department
Sure,
and giving
yeah.
them direct consults from you after a surgery. Tell us a little more about that collaboration you have with other service lines in the hospital.
Well, orthopedics is unique in that we really have the opportunity to work in a variety of venues in the hospital, and oftentimes we start in the emergency room or we start in the clinic. We end up in the operating room, but then we follow up with patients on the floors. We follow up with patients in the rehab units thereafter, and just have a real broad spectrum of experience with the patients and with the physicians and all the professionals in the whole hospital area.
And you can really truly take care of that patient from entry to that final of that
Right.
patient feeling better.
But it's important to note that we do it as a team. I can't do it alone. I do it in conjunction with Sarah and Dr. Schwimley and a whole variety of people here in the hospital, the techs, the therapists, the people in the OR, the orderlies. It's a team game.
When I come see you guys, it's very evident on how all of you really help build each other up and make that happen for the
Well,
patient.
that makes it fun.
Yeah.
Because we've become a family doing it.
And the person that benefits the most is that patient.
I think so.
Getting them back
Yeah.
to getting them back to feeling better and living a life they really want. Sarah, the opportunity I know that you've had working in orthopedics, tell me your passion for taking care of that patient. Where do you see yourself helping that patient the most?
I mean, I think, people hear, oh, you're in orthopedics, like, you don't know anything about, anything else. But, it's a lot of education. It's more than just bones or muscles or that specific injury. We answer questions about regular medications. We're giving, education before surgery on, different medications that they need to, maybe not be on or stop, or providing education with stuff that they will have to do after surgery. Some of it is orthopedic related, and some is just in general.
Right.
So it's not just orthopedics. We're answering questions that they may have about medications, or helping get appointments, with family providers for physicals prior to surgery, or helping get them set up with therapies, or any other appointments that they may need. And a lot of times the patients don't understand, well, you guys are going to fix me, so why do I have to see anybody else?
Sure.
And so it's a lot of education on why we have to do the things that we do. And it's things that, by us being able to answer those questions for the patients, it frees up, some of the providers' time, so they're able to assist, with another patient.
Well, and work with that primary. Again, like you said, you're clearing these patients for surgery. You're looking at every aspect.
Right.
It's not
Right.
just that fracture that needs to be fixed. It's, well, is their heart okay? Are they going to be able to move after surgery? Who's going to take care of them after surgery? You're truly taking care of that patient fully.
I have to tell you, I really rely on Sarah to pick things up that I miss, because
Sure.
sometimes it becomes easy to focus in on a problem,
Sure.
and then Sarah says, oh yeah, but you need to know this about this person.
Correct.
And that may change the entire approach to
Absolutely.
a specific problem. So entirely a team game.
Absolutely.
Here we
And
go.
your surgery team.
Yeah, and the surgery team as well.
That's a
And
whole nother
with
level.
Mike and down in the operating room
Absolutely.
with the guys and gals down there.
Right. So with your cases, what's your? I know there's an endless list of trauma, shoulder, foot and ankle, scopes, hip and knee replacements. Several of my patients have had carpal tunnel surgery. Endlessly complimenting your approach and care of them. But what triggers you the most with surgeries? What's that one thing that you come in and you see and you're like, oh yeah, like what gives you the most interest?
Well, I think one of my focuses has been on immediate gratification, and that means fixing stuff.
Yeah.
If somebody comes in with a broken tibia and you have it in 2 or 3 pieces and you can fix it, and they can start moving that leg or walking on it almost immediately, that's a big change. And that's a paradigm shift from 50 years ago or 40 years ago, when a patient would be in a cast for 6 weeks or in traction. Now they get an operation for an hour or 2 hours, and they're up putting weight on the leg.
Sure.
And that has changed rehab, the rehab of many people dramatically. So that's to me, that's just an exciting part of orthopedics. And it's one of the things that's changed in orthopedics significantly, particularly in the last 20, 30 years.
It's just the follow-up care and post-surgery.
Yeah.
Yeah, that's amazing. Sarah, what's one thing you could ease a patient's mind about if they were having a hip problem that they've been tolerating for months, years? just a little bit of anxiety about coming in and visiting with you. What's a couple tips you would give them to help relieve that anxiety?
If you don't ever come in to have it, looked at or discussed in that, you're never going to know if it's something that, can be fixed.
Sure.
Even if it's just some pain relief, that can affect your whole outcome with what you're able to do just in your daily life. People get depressed because they have pain. And they aren't able to do things that they enjoy doing.
Sure.
But a lot of times, yes, they get very anxious about coming in. Just knowing that, we're here to listen to you. We're not going to judge. We just want you to tell us your story so that we're able to help you and, be able to improve your quality of life.
And often patients are fearful that you visit a physician, you're going to get bad news or maybe something that's not optimal. But in reality, a lot of times you can give patients good news, whether it's a quick treatment, something that they can do different, maybe an exercise. And so truly, I think a lot of that anxiety could be relieved if they knew, that you're giving them positive news. So that's kind of neat. We talked about moving and moving well. You're my biker, swimmer. Tell us a little bit about, we didn't catch you talking about life outside of work.
Well, life outside of work is wonderful in Oski.
Isn't it?
I just took a nap at noon today. But a lot of times I'll swim at noon or in the afternoons, which I plan to do today. And there's just a great number of things to do. I like being out and active and trying to stay in shape. I try to impart that on my patients and show my patients how important that is for their health and the health of their joint replacement or their fracture fixation or the health of their carpal tunnel release. It's important to stay in shape.
And you're a good role model for that, staying active,
Loving
your community.
Try to, yeah.
Loving your community.
Yeah.
You guys have been wonderful. Thank you for joining us, and I again see our patients full of hope and knowing that their pain has been relieved. They know that they've had help. They know that they have you guys to rely on. Thank you both for being here at Mahaska Health, and I'm honored to have you both here.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.